Hello, let me tell you a story of a new mother experiencing postpartum pain and was prescribed the painkiller Tylenol. However, this medication leads to severe side effects for both mother and the baby. The mother's baby unexpectedly dies and the autopsy reveals the high level of morphine in the baby's blood, leading to the consideration of infanticide. This case study is real and was published in Lancet in 2006, identifying codeine as the culprit. Codeine, which was present in Tylenol, is commonly prescribed for postpartum pain, yet most mothers have the healthy babies. Codeine is effective if used in a tailored fashion. Genetic variations are a major cause of the adverse drug reactions, posing a significant burden on the healthcare system. Now imagine a doctor who can prescribe you a medicine that works best for your body based on your unique genes. This isn't science fiction, it's the reality of pharmacogenetics. Genetics is the study of genes, which are the building blocks of our bodies. Pharmacogenetics is about how our genes affect how we respond to medicines. Just like everyone has unique fingerprints, we also have unique genetic codes. These codes can influence how our bodies break down and effectiveness of the medicine at the target. Now, why is this important? Some people might need a higher dosage of a medicine, while others might have the side effects for even a small dose. Pharmacogenetics can help doctors figure out the right dosage and the medication tailored to the individual patient. Now, how does it work? Doctors can test your DNA to define specific genetic variations. These variations can tell how your body might react to certain medicines. For example, some people might have a genetic variation that makes them process a medicine very quickly. So they might need a high dosage. Others might have a variation that makes them process a medicine slowly. So they might need a lower dose. Now let me give you some real life examples. Example like warfarin. This is a blood thinner which is used to prevent blood clots, but the right dose can vary a lot from person to person. Some people might need a higher dose of a blood thinner, warfarin, because their genes break it down faster. Others might need a lower dose to prevent the bleeding. Pharmacogenetics can help doctor find the best dose for each patient by analyzing genetic variations in genes involved in warfarin metabolism. Clinicians can determine the optimal starting dose and adjust it to as needed to maintain the therapeutic levels. Another example can be the severe cardiac death. By understanding the genetic factors that contribute to the SCD risk, clinicians can tailor medications regimes to individual patients, reducing the likelihood of fatal cardiac events. One key area of focus is the genetic variations that affect the heart's electrical system. The variations can increase the risk of abnormal heart rhythms such as ventricular tachycardia, which can lead to SCD. Pharmacogenetic testing can identify individuals at high risk for these arrhythmias, allowing for early intervention with appropriate medication. For example, beta blockers are commonly used to treat heart failure and reduce the risk of SCD. However, the optimal dose of beta blockers can vary depending on individual genetic factors. Testing can help determine the most effective dose for each patient, maximizing the benefits while minimizing the risk of side effects. Similarly, the another drug, clopidogrel, this is an antiplatelet medication used to prevent the blood clots after heart attacks or strokes. However, some individuals may have genetic variation that reduce the effectiveness of clopidogrel. By identifying these variations, clinicians can switch to alternative antiplatelet medication that are more likely to be effective. Now, in conclusion, we can say that pharmacogenetics is a very promising field that has the potential to revolutionize the healthcare. By understanding how our genes influence our responses to medicines, we can create a more personalized and effective approach to treatment. Thank you.